Good evening and welcome to Career Day here at the Community Center. My name is Marissa Garza and I'm currently majoring in Allied Health. When you think of nurses, you think of the person who sees you before the doctor sees you in an exam room. Or if you've ever been admitted in a hospital, the person who comes to check on you every hour or so. You probably see your nurse more often than your doctor. The career I have chosen to pursue is becoming a registered nurse in pediatric oncology. According to the Bureau of Labor Statistics from BLS.gov, which was last updated in January of 2014, a registered nurse is defined as someone who provides and coordinates patient care, educates patients and the public about various health conditions, and provides advice and emotional support to the patients and their family. With most of my family in some sort of medical profession, nursing has always been an interest of mine. Today I would like to inform you a bit about the responsibilities of a registered nurse, where they work, and how you can go about pursuing a career in nursing. First, I would like to talk to you about what a registered nurse does. Just like doctors can choose to pursue a certain specialty, nurses can also choose to work in a certain area. They can work in medical or surgical, such as in an OR room, in critical care, in geriatrics, which is working with elderly patients, neurology, pediatric oncology, which is my focus, and several more. As I mentioned earlier, you probably remember the nurses in hospitals that take care of you. You see them way more often than your doctor. RNs are the ones who take care of you the majority of the time. They must be able to administer medicine, such as giving someone insulin if they're insulin dependent, record patient observations, and then report back to the doctor. They must also be able to help in performing diagnostic tests and consult with doctors and other healthcare professionals. Using their skills, nurses must also be able to create a plan of care for their patients. These are all some of the responsibilities of a registered nurse, and some of these can even change depending on what field you decide to go into. Next, I would like to speak to you about where a registered nurse can be employed. The possibilities of employment for a registered nurse are endless. RNs can work in hospitals, clinics or offices, military, school nurses, or even as a flight care nurse. RNs can even be private home health care nurses. For example, an elderly patient that may live by themselves, if they qualify, can have their own private home care nurse that comes to check on their vitals or to help assist them in everyday chores. Lastly, I would like to speak to you about how you can become a registered nurse. Nursing is a very science-heavy profession, and it's recommended that you make A's in most of your courses to be taken seriously. If you want to pursue a career in nursing, you must take courses such as anatomy, physiology, microbiology, chemistry, nutrition, and so on. Nursing also requires you take several social and behavioral science classes. Classes such as critical thinking or philosophy, communication, such as speech, and leadership classes. Most nursing schools also require that you take some sort of test as the TEAS or the HESI, which is a test that assesses your basic academic knowledge. According to nursinglicensure.org, which was last updated in January of 2013, to become an RN, you must attend an approved program that includes at least 2 academic years of coursework. Most nursing schools also look more closely at those who already have a bachelor's degree. So say that you go to Texas A&M and complete a degree in Allied Health, a 4-year degree. When applying to nursing school, you will be taken as top priority in the application review because you already have a Bachelor of Science in a health or science field. Lastly, you must take and pass the NCLEX, or the National Council Licensing Exam, in order to obtain your registered nurse license. Some requirements for licensing can also vary by which state you live in, but you can easily find each state's Board of Nursing requirements by searching on the National Council of State Boards of Nursing. Nursing is a career that requires compassion and the ability to make decisions when necessary. You must also be able to problem solve, and I think it's something that I would do well in. It's a great career to pursue because there will always be a career in healthcare. And according to the Bureau of Labor Statistics from BLS.gov, which was last updated in January of 2014, the RN workforce is expected to increase by 19% by 2022. Now that you too know a little bit about the duties of a registered nurse, where they can work, and how to go about becoming one, I hope you too will take as much of an interest in this career as I did. Thank you.